Good morning, everybody. Welcome to the 2020 Virtual Homeless Awareness Conference. I hope you've enjoyed it so far. Welcome to this breakout session. It's titled Finding Opportunities in Crisis. And I'd like to, my name is Jason Kasamoto. I work for Scott Morishige in the Office of the Governor's Coordinator on Homelessness, and I'll be your host today for this session. And I'd like to introduce our panelists joining us today for this session. From the University of Hawaii, we have Dr. Victoria Fan. And then from the Department of Health, we have Dr. Amy Curtis, Joshua Holmes, and Edward Mersereau. And at this time, I would like to pass the baton to Eddie, and he can take it from there.
Yeah, thanks, Jason, and good morning, everybody. And glad we could join you today and be a part of this conference. It's a really incredible conference. It's the first of its kind, I think, for Hawaii at least. So we're super excited and super happy to be a part of it. What we wanted to do when we were, when Mark reached out to, and Scott reached out to me to kind of talk about and be a part of this conference, what we really wanted to talk about and what became apparent was that we wanted to really focus on how do we address the current COVID crisis, and then just in general crisis, and how do we find opportunities from the crises that we are involved in. And so we wanted to use some of the examples and some of the work that we've done over the past 8 months or so in coordination with a lot of you folks, a lot of partners with the state, partners with the city and county, partners with the, in partnership with community organizations. And we wanted to just kind of present this kind of focus on pulling opportunity out of crisis and seeing where we can go from here, looking at what we've done and seeing where we can go from here, kind of a what, so what, and then a now what. And so what we thought we would do is, on the next slide, we have 3 questions that we actually wanted to put out, that we were asking ourselves as well, but we want to put out to you guys, to the attendees, and ask you to think about, and as we go through this presentation, to think about these 3 questions, because what we want to do is towards the end, we want to have some interactive discussions through chat and stuff like that about how we answer these 3 questions. How do we deal with crisis? How do you find opportunities in crisis? And what opportunities do we see coming on the horizon? How do we connect the dots? We know that COVID will be with us for a while. And I think of COVID as kind of the first wave of this kind of additional waves of crises. And a bigger wave, in my opinion, is coming, and that is the impacts of COVID-19, especially in Hawaii, on things like socioeconomics and housing and the economy and stuff like that. Earlier, there was a presentation where there was discussion about when the moratorium for evictions is lifted, we're probably going to see a lot more evictions and increases in homelessness and stuff like that. And the intersection of behavioral health, homelessness, and substance abuse, and the way that those 3 things are impacted by, especially by COVID-19 and by the kind of broader economic effects of COVID-19 for the state, are going to continue to be things that we're going to have to deal with in the coming years, 2 years at least, I think, if not longer than that. So the question really becomes, how do we take that crisis, just like we do in clinical practice, and find the opportunity for growth and evolution of the healthcare system, the behavioral healthcare system, the homeless care system, and move towards a better place than we were before this crisis happened. We do know that we were dealing with issues around crisis in the homelessness and behavioral health system prior to COVID, and there was already a lot of work going on to try to link and sync and to try to coordinate the different components of the system so that we could be more responsive and utilize resources more effectively. And so we really wanted to kind of focus on this whole idea of pulling that opportunity out of the crisis that we're in now. A lot of people are struggling with uncertainty and fear, both ourselves as well as the consumers and the individuals and the people that we work with. So we really want to look at how we do that and provide some examples. So with that, I'm going to turn it over to some of my amazing team that we've been working together all through this COVID-19 situation, and who have been amazing. Victoria, Amy, and Josh, a lot of you guys know them and have worked with them, and couldn't have done any of the things that we've done without a lot of effort on their part. So first I want to turn it over to Victoria to talk about this kind of philosophy of the two-sided coin of crisis and opportunity.
Thank you, Eddie. I think, the past 8 or 9 months have just been extremely just beyond words, I think, for many people. These COVID crises is actually a series of all kinds of crises. Firstly being a lack of information about this new and unknown disease. But I think compounding that, I think, is the fact that the confusion that could arise from sort of lack of information and fragmented communication channels, lack of resources, and also lack of coordination, and just an overall, I think historically, a fragmented approach to addressing both homelessness and behavioral health together. And sort of the philosophy, I think, that Eddie is referring to is really from Eddie, but I think, if you look at the Chinese words or the Japanese kanji as well as the same word, the word for crisis actually has 2 parts to it. Of course, the Chinese love to do breakdowns of the words and try to understand more about what it means. But crisis has 2 parts to it. First is an aspect of danger, the threat of COVID and all the economic and sociological and psychological impacts from COVID, but also an opportunity as well. And I think COVID, I think for many people may have emphasized a great deal about the danger aspect, but I think just like we're always trying to see the silver lining or the good in what may be a very bad situation, I'm really appreciative of the opportunities to work from the University of Hawaii's perspective with the Department of Health, with City and County, with Governor's Coordinator on Homelessness and the BHH Surge group writ large. And as we sort of do a look back to all the different things that have been taking place, it's really kind of mind-boggling in some sense about all the different things that have been going on, not just by BHH Surge, but all kinds of groups, in the state. And I think gives me hope in many ways about, the good things that are happening despite, what is really a terrible situation. And so this slide here just gives you a snippet of all the different keywords and activities that have been going on through BHH Surge, through Eddie's leadership and Scott's leadership. And as part of the BHH Surge, there were so many activities that have been going on when we first mobilized at the end of February, in terms of providing provider guidance so that it was unified guidance to all the providers, sending out requests for PPE to the providers, distributing them through resilience hubs, which we'll talk a little bit more about shortly, setting up the state's only temporary quarantine and isolation center. Again, we'll have more details about this as well. Decision trees and screening tools about when you should wear PPE or not, when you should get telehealth or not, and further setting up the statewide isolation and quarantine hotels and coordination system starting in mid-August. and then further strength supporting the work that the Department of Health is doing in terms of epidemic investigation of populations in correctional facilities and homeless shelters and things like that, as well as building upon the work from Hawaii Cares as a one-stop shop for people in crisis and in need of resources, and then using data to try to communicate where we are with the situation. So we have been supporting the work of HIPAM, the Hawaii Pandemic Applied Modeling Work Group, the DOH COVID dashboard, the behavioral health dashboard, as well as webinars and newsletter. And if this seems overwhelming, I apologize. It's just to give you this is the outline of what we're going to try to run through today. But really, it's really emphasizing, collaboration and partnership and unity, I think, in moving forward. I'm going to pass it over to my colleague, Josh, to talk about ICQ.
Thanks, Victoria. So while COVID-19 brought on many new challenges, exacerbated existing ones, there have been many opportunities to continue and amplify our impact. So alongside prevention, contact tracing, and testing, which I think everyone's heard about a lot, isolation quarantine is one of the major public health measures to help combat a pandemic. And by isolation, I'm referring to safely separating people who are infected with a virus or some type of infectious agent away from others who are not. And quarantine is referring to separating people who have been exposed to somebody who is infected and monitoring them for symptoms or if they end up testing positive. And for many populations, it is challenging to safely isolate and quarantine in place. And in behavioral health and medicine, people's needs exist along a continuum, and their needs and level of acuity may change over time, sometimes very quickly. So while people are in isolation and quarantine, they're not in this sort of vacuum or bubble. Their behavioral health and medical needs will still persist and may even be exacerbated. That is why early on in the year, the Department of Health Behavioral Health Administration, alongside City and County, the Hawaii Health and Harm Reduction Center, Local 5, IHS, and other partners, established the state's first and only temporary quarantine and isolation center on Oahu. And this was initially set up to help homeless individuals with quarantine and isolation, and also be an opportunity to provide the necessary medical, behavioral health, and social services to them on site. And I'll actually be sharing some of the outcomes of our initial white paper from back in May on the next slide. But since its inception, we've been able to help hundreds of clients, and they continue to be helped there. And as Victoria mentioned, back in August, BHA took oversight of the isolation quarantine for everyone on the island of Oahu. And with that, we've developed a centralized referral mechanism. We've coordinated 24/7 transport, 3 times a day food delivery, 7+ either hotels or isolation centers, and on-site case management services are provided to all clients. And what we do is at intake, cases are triaged, and we help determine their best placement based off of their medical and behavioral health needs and acuity levels. And we also recognize that people's needs may change over time. So the process, there's processes in place where they can either be referred to like a step-up care or even step down. But really, this has been a really opportunity to assist our most vulnerable populations while they're safely isolating and quarantining, and getting them the treatment they need, getting them connected to treatment upon discharge, providing social services, and even connecting them to housing. Next slide, please. So this is the infographic from the white paper. We'll have the website, I think, on a later slide, but we welcome anybody to go on and that's interested in reading about how successful the first few months of the TQIC was. But in May, we had 51 clients who had been to the TQIC at that time, and nearly all clients who went to TQIC left with an improved disposition. There was just one person where their conditions worsened and they actually needed to be referred back to the hospital for that type of level of care. But as you can see, not only were they able to safely isolate and quarantine, but more than half were actually connected to some sort of housing upon discharge. Our clients were medically complex. 38 had a substance use disorder, 39 had mental health issues, many had uncontrolled chronic conditions. So some of these, you can see 13 people received on-site medical detox from alcohol, 6 received psychological evaluation, and 14 had uncontrolled diabetes and were provided the proper treatment and medication. So you can just see that the wide array of complex medical and behavioral issues, like many of our homeless and vulnerable populations face, we were able to address during their stay while at Pico. And we're actually going to have a part 2 of our paper since it has been several months since our last one. So we'll be really excited to share more of the outcomes of that in the near future. Next slide, please. So these are some of our data bites from the isolation quarantine for the whole island of Oahu since when we began to take oversight in August. So we've received, I think at this point now, the data is just a few days old, but we've received over 2,300 requests for isolation and quarantine, testing and/or external food assistance. Among these, almost 2/3 or 3/5 were for people who were already COVID positive. Of these, 1,035 people who are positive requested isolation and quarantine. And when we look at the number of cases over this same time frame from August 14th to November 16th, it represents about 10% of all cases on Oahu. And BHA, along with University of Hawaii, did some projections, early projections, and determined that about 10% of those, from 10% of people wouldn't be able to safely isolate in place and would need some sort of external placement. And then nearly 1 in 5 of our referrals are for people who are experiencing homelessness. And when we look at those of who we've actually been able to place, so since August, there's been 1,600 individuals that we've been able to get in safely into isolation and quarantine, and about 401 families. And about 44% of those are Native Hawaiian and other Pacific Islander. As everyone's probably seen in the news, our Pacific Islander populations have been disproportionately affected by COVID-19.
And thanks, Josh. Just to continue a little bit with the data bites, it is important that we look at this population and examine it in light of COVID, because in looking at almost 2,000 or 3,000 COVID-19 tests that have been conducted among the homeless by Project Vision, and this is from July 11th through October 26th, you can see that almost 7% of those were positive. Some of these were testings that were occurring because of clusters, but many others were simply surveillance testing. And so to see that level of positivity among the tests that are occurring, again, just points to the importance of examining homelessness and COVID the way that we have been doing and having the ISOQ available. Next slide. And I think another important impact has been being able to, of COVID or an opportunity out of the crisis, has been able to look at this as a system rather than these fragmented pieces. So very quickly, when we started coming in August, there were clusters that were going on in corrections, and then we started to examine clusters that were occurring in homeless shelters and behavioral health treatment facilities and in other locations. And what we realized is we've got to work together. This is a whole system. And if we work together, then we can do a much better job of mitigating, preventing, mitigating, controlling what's occurring rather than having it become worse. We're seeing also that if we do get these outbreaks that occur in these congregate settings, there can be some long-term impacts, and it can be very difficult to put out these clusters quickly. Although I will say, I think there's been a wonderful partnership and folks have come together very quickly to be able to do what they need to do to ensure that we get the individuals identified, that they're appropriately placed in isolation or quarantine, and we do what we can to put out that cluster and that fire with that cluster as quickly as possible. We are continuing to see some, variations in where we're seeing the positives among this circle going on, at least in Oahu and other areas as well. So I will point out that I think it's important for us to continue to work together and to be able to test in these different locations, identify when we see some positive or clusters coming up, and be able to work together again to end that cluster as quickly as possible, get those individuals into isolation and quarantine, be able to treat those that need to be treated, and step in as quickly as possible as a team rather than individuals. So I think we're happy at how that's been able to occur really quickly here since August.
as part of our efforts to integrate and bring together groups that typically have been fragmented and sort of not necessarily working in sync or in concert with each other, one of the early activities that we did was we did an assessment of all of the providers that are contracted with or working with the Behavioral Health Administration across the 4 divisions. And we also looked at the extent to which they were also working on homelessness as well. And as you can see from this graph, the majority of the BHA contracted or affiliated providers also provide homelessness services, just reinforcing the importance of an integrated approach, one that takes a unified approach to providing resources and coordination to supporting these populations. Other activities of the BHH surge included a fairly extensive website, and if you visit bhhsurge.hawaii.gov, you'll see a whole variety of resources available. We invite you and encourage you to check it out. Very early on, I think it was early March or mid-March, we put out guidance for behavioral health and homelessness providers on very detailed issues on billing, on telehealth, administrative updates. We also had a 24-hour turnaround on questions that would have been, that could be submitted to the website. And we also have numerous decision trees, as I mentioned, on this website. So there's just an enormous amount of resources, and we invite everyone to check out those resources if you haven't done so already. I'm going to pass it. Go ahead, Josh.
Thank you, Victoria. So one highly successful private-public partnership has been the creation of these resilience hubs here on Oahu and dissemination of PPE to providers statewide. I actually really just want to give kudos and thanks to our logistics lead, Casey Haitsuka, Rebecca Choi, who've really done amazing, incredible work with such limited resources. But early on, we recognized that securing PPE for behavioral health, homeless, domestic violence, and other social service providers is crucial. These services are essential, and they are on the front lines each and every day working with clients. So not only do the clients need to be protected, but also the providers. So we partnered with the Hawaii Community Foundation, as well as Proc Center, YMCA Kalihi, Key Project, and Black Sand Capital to establish these resilience hubs, which are found in 3 locations on the island of Oahu. And really they act as a community hub and distribution center, where initially we were having people donate supplies and PPE, and they also act as a warehouse where these PPE can be safely stored. And then once providers are in need of PPE and we are fulfilling orders, they can be used as a sort of one-stop place where providers can get the PPE that they need. And we were able to identify that there was such a large need in PPE was back in March, we did a survey among providers, and we identified that the need of PPE were in the tens of thousands. So we've been able to actually get hundreds of thousands of units of PPE, mainly through donations from the community and organizations. Can you click just one? Sorry, I made an animation. Here, just some of where we've been able to get donations by county and then by organization. So again, really thankful for most of them. They've been mostly private donations or through organizations, and we've been able to help dozens of providers across the state with their PPE and other types of sanitation supply needs.
Awesome, thanks, Josh. And just to add that the Resilience Hub is just an incredible effort, I think, of public-private partnership and kind of finding the opportunity in this particular crisis, including lack of resources for this really important protective equipment. Another area that has been, I think, valuable to the BHH surge activities has been the Hawaii Cares hotline. And for those of you who aren't familiar with it, it's a 24/7 helpline or hotline that is available to anyone in the state of Hawaii. And you can, if you're on Oahu, you can call 832-3100 or toll free 1-800-753-6879. You can also visit our new website, hawaiicares.hawaii.gov. And it was an existing hotline assisting those in crisis or people seeking help with mental health, as well as recovery resources for substance use. But I think one big challenge for the public has been a lack of information, and information that's not easily accessible. And so Hawaii Cares, I think, being a 24/7 helpline has become a resource, in my view, for anyone to call in and ask all kinds of questions that they might have about anything under the sun about COVID, and really being a voice, an ear to all the voices in the communities, and all the struggles that people are going through. And it was also the mechanism by which we routed through. You saw those thousands of requests. They wouldn't have been possible without Hawaii Cares to support all those individuals needing isolation and quarantine. And so I'm extremely grateful to all of the Hawaii Cares team members who've been fielding an enormous volume of calls in the past year. Again, we want to encourage you to make sure you have this information available. Should you find yourself or someone you love in need of help, and please give us feedback if you have any experiences, both positive and negative, with our hotline. Another key activity that we did, we turned this around in about 3 weeks, I think. Our lab here at the University of Hawaii, our Pacific Health Analytics Collaborative, built out the Hawaii Behavioral Health Dashboard. And you can visit it at www.hawaii.edu/aging/dashboard, and there's a bunch of interactive graphs. This is just from the screenshot from the first page, but I think highlights the enormous need that the community is experiencing in the past several months. And in June and July, even before Hawaii Cares started taking on the support for isolation and quarantine, we were seeing the highest numbers of calls that the line had ever seen in the past 7 years. So we had 2 months of record-breaking call volumes, which I think just goes to show you that there's a huge need in the community for information and for help and for resources. And having the Hawaii Cares line available for anyone to just call in, I think is just in my view, just an incredible resource, and I'm really grateful to be a part of. And we invite you as well to check out the dashboard and give us your feedback. Pass it over to Amy.
All right, and then one of the other ways that we tried to use opportunity out of this crisis was looking at some of the federal funding that was available to help us with COVID. I just want to describe 2 projects that we were funded for under SAMHSA federal funding related to COVID that we think can really help, we hope, efforts that we're already doing in these populations we're discussing. One is a homeless outreach project to get short-term case management and linkage to longer-term care for individuals with less than severe mental illness. We do have homeless outreach that's been available through the Adult Mental Health Division, through contracted providers, but it's only been available to those with severe mental illness. There's still a large population out there of need, including those with co-occurring substance use disorders as well. So we were very excited that we're able to roll this out. It started in October. We were able to find providers so far in Maui, in Hawaii, and in Oahu as well, still looking for Kauai, and we'll continue to do that, but very excited to be able to offer that, to be able to have take care of those short-term needs, but also be able to link those individuals to longer-term care, case management, and housing as well. Right. And the next project, some of you may have heard us discuss as well, is Palikana. We had Palikana on Oahu, and now thanks to this same funding source, we were able to open Palikana Elua on the Big Island. This is a wraparound residential program for consumers really focused on those with co-occurring substance use and severe mental illness. Many of these individuals have a long history of homelessness, hospitalizations, justice involvement. They're individuals that have really found it difficult to be able to remain successfully in the community, and this program is designed to help them do that. It has program pieces that are based on the best practices. There's 6 different levels that they go through, incorporates recovery practices within it, You can see a whole host of things it includes, including those medical and mental health monitoring, the trauma therapy, art and music therapy, mindfulness, horticultural therapy, and also importantly, the volunteerism, but also moving toward employment. And then again, moving the exercise, cultural awareness, and then hopefully going through those 6 levels and being able to get into community housing after graduation. I want to point out again, these are individuals that many times was very difficult to find a program that was willing to house them. There had been a rougher road to recovery in this case, and was really looking for a program that would help these individuals. So far, a little bit a taste of the outcomes. I think we're on the next slide. We've had 80% of these individuals have successfully completed the first 60 days of the program, which is actually really important and unusual for some of these individuals, and how quickly they had been either ended up back in the criminal justice system or back into a hospitalized or inpatient setting. We've also had 3 successful graduates that have gone through all 6 program steps, employed, living successfully in the community, and that includes 2 who have been chronically homeless for years. So very excited so far about being able to do this. We are expanding the numbers that we'll have in Oahu up even perhaps to 24, and then we're able to have up to 8 spots right now on the Big Island. These are individuals that we didn't have a program like this at all on the Big Island. We were often having to fly them over to a different place simply to care for them. So we're really excited about what this can mean, and we'll continue to look at how to refine it and improve it.
And we realized frequent communication and coordination was key, especially as guidance, resources available, shared lessons, and the pandemic here on Oahu continue to evolve so quickly. So we began to host a weekly webinar with our stakeholders and leadership from the behavioral health, homeless, medical, domestic violence, other social service provider communities that grew into this popular series attended by upwards of 400 plus participants. And I think it's been a very valuable way for peers to share some of their challenges and successes that they've faced this past year. We've also been able to provide and offer CEs to individuals who have attended, as well as had some trainings. And we really welcome all of you to visit our website and check out all of the webinars. They're recorded and available there. And then you can sign up for our listserv and watch our future webinars live. But as you can see, we've had several dozen different partners come on, and I think it's been really one of the highlights for many individuals each week to tune in on their lunchtime at 12 on Mondays and sort of see what's happening with everybody.
So those are, hopefully that was helpful. Those are just some of the things that that in partnership with all of the folks that have been mentioned, city and county, governor's coordinator on homelessness, a lot of you folks. Those are some of the things that we've done to respond to the crisis and deal with the crisis. A lot of it had to do with kind of linking and syncing, coordinating, making sure that people are on the same page, trying to get all of the different efforts and stuff like that coordinated and so that everybody kind of had an idea what others were doing so that we could link and sync in that way. But I want to pause here for a second and just throw this question out to you folks, and maybe you could just throw something in the Q&A or in the chat. Even before we look at how do we deal with a crisis, what we want to do is kind of understand what constitutes a crisis. So like a lot of us, I know you've dealt with crises with individual clients and consumers and stuff like that. What constitutes a crisis? Why do we have crisis? And the same is true for systems and social communities and stuff like that. But what is it that constitutes a crisis? How do we know that something is a crisis? I'll give it a second to see if there's anybody that wants to throw out an answer. Come on, I see a lot of smart people on this that are attending. Throw it in the Q&A. No wrong answer. Okay, so if this was a classroom, I would be telling people, I would be calling on people. Yes, so River, awesome, first one to respond, and Clement, thank you guys for responding. So that's exactly, River, that's exactly kind of for me the what I've always, from a clinical standpoint and from a kind of systems perspective standpoint, I've always thought about as in terms of how we know something is in a crisis. And that's when somebody's coping skills can no longer help them deal with the particular event. And if you think about what COVID-19 has done for us, not only just in this state, but across the world, we had very little kind of, there was no playbook for us for COVID, or if there were things that we had, lessons that we maybe had learned from past pandemics, we didn't really, those things weren't really kind of ingrained as normal coping skills that we could rely on and fall back on to be able to manage and address and cope with what was in front of us. And so what COVID-19 did for us as a system, as a state, as an economy, as a community, was it ripped away all of the normal coping skills, or not all of them, but a lot of the normal coping skills that we had kind of previously utilized for other situations. And those that it didn't rip away were not necessarily workable for us in the face or in the context of COVID-19. So a good example is the normal community outreach that we did for homelessness, or that we previously did for homelessness. All of that was kind of back to square one. You couldn't just go out and meet with clients face to face out in the community. You had to think about what kind of PPE you needed. You had to think about what kind of precautions and infection control measures you had to take. Similarly, with tourism kind of shutting down, a lot of the kind of focus, or a lot of the thinking about how things are funded and how things are done are already starting to be questioned, and kind of we're going to have to re-examine all of those things. So absolutely, it becomes, we know that we're in a crisis when the normal coping skills, like River talked about, are no longer kind of workable. They're no longer effective for dealing with the issues that are in front of us right there and then. So then the next, and as Justin's talking about, it comes down to a breakdown of our ability to meet our basic responsibilities, our basic needs, our basic kind of mandates as a system of care, as a homelessness system of care, or as a behavioral health system of care. And so this is how we know we're in a crisis. So then the next step is, when you know you're in a crisis, what do? What is the first thing that we have to do when we're faced with a crisis, or we're dealing with somebody who's in crisis? What's the first thing? Throw it out there in the question and answer. For me, when I've both in my when I've done clinical work, direct practice clinical work, as well as in the systems that I've worked in and been a part of, first things first, step back and take a breath and assess the situation, right? In most crises, the best thing to do is to look at what the most viable and effective immediate response is to mitigate the crisis. So I'll share a little quick story. When my wife and I were first dating, we had our first Christmas together, and she wanted to make it a special Christmas, and we were watching It's a Wonderful Life, and we had candles and stuff like that. And one of the candles on a shelf had burnt down just to the oil and it had started to sputter. I think it was kind of a cheap candle. And there was this big kind of blue flame kind of starting to sputter out of it. And we both stood up and looked at it. And I was standing there for a second, kind of processing something. And she thought that I was frozen with fear about this candle that was looking like it was going to burn out and had blue flames coming out of it. And she thought to herself, I know what I'll do is I'll just throw some water on it. So she took her cup of water and threw the water onto the candle, this kind of burning oil. And you can guess what happened, right? So it just exploded that oil, water and oil, burning water and oil, they don't mix. So that oil exploded up the wall, started to burn this poster that we had on the wall, and almost burnt our living room down. So the reason why I'm sharing this with you is because my pause was not because I didn't know what to do or because I was frozen in fear. My pause was because I was wanting to make sure that I deliberately assessed the situation so that I could find the most effective immediate response. And it only takes a few seconds sometimes to do that. And right when my wife was throwing water on the oil, I was reaching for something to smother the flame. And so the idea, again, like River is saying, backing out of the immediate crisis situation, taking a step back and taking a breather, right? And going and assessing what's going on. And I think a lot of times what happens when people are in crises or when systems are in crises, we maybe don't do enough of that. We maybe don't kind of take that step back and assess and go, what's going on and who's doing what? And how can we respond in a coordinated, deliberate, strategic way? And then that brings us to the next question of what do we do in a crisis? And how do we take advantage of this last question that we have? How do we find those opportunities out of the crisis? When we look back over the last 8 months, part of the reason why we wanted to share the different things that were accomplished is because when you look at the different systems that were put in place, the different kind of programs and activities and resources that were put into place, all of them were kind of following a pretty basic formula. All of the things that we did from the Behavioral Health Administration standpoint, and the things that Josh and Amy and Victoria have shared with you, followed kind of 3 simple kind of principles. Principle number 1, it had to respond effectively to the crisis that we were in. So the immediate crisis, which was COVID-19, and what do we do about COVID-19 in relationship to homelessness and behavioral health. So principle number 1, it had to respond effectively. And I think a lot of, as you saw the numbers, a lot of the things that we did, in my mind, nothing's ever perfect, but in my mind, had effective responses to the crises that we were looking at. Secondly, it had to look at the bigger picture. It couldn't just look at just what was in front of us. It had to look at everything from a systems perspective. And so we would look at the things like the weekly webinars that we put together. It was looking at, and that Scott, thank you very much, Scott Morshige, for taking over the operation of those webinars. But those webinars had to be the big focus was to look at it from a broader system so that we could address more broad issues, because as you see, and as a lot of you have seen, the COVID-19 hasn't just worked in a vacuum. So a good example of that is the OCCC outbreaks. The OCCC outbreaks impacted not only OCCC, but it impacted the homeless care system, it impacted the behavioral health care system, it impacted the physical care system, all in kind of interchangeably. And so second principle was all of the things that we did needed to be not only addressing that specific one issue, but it had to be looking at it from a broader systems perspective. And then the third principle, as much as possible, we wanted to make sure that every response that we implemented to this crisis would be something that could be durable and lasting. In other words, it wasn't something that, as much as we possibly could, in some cases that wasn't, it didn't happen that way. But as much as we possibly could, we wanted to make sure that everything that we did in response to the crisis addressed the first two principles, but also had something that we could kind of continue on with, a durable asset, so to speak. So when we think about things like isolation quarantine, the isolation quarantine sites that we set up, the hope is that to some extent, those assets that we set up in response to COVID-19, which will continue to hopefully be able to respond to COVID-19, will also be durable assets to address other crisis issues that we see coming, right? So we go full circle into this idea that if the reason why we're in a crisis is because our normal coping mechanisms or our normal mechanisms for responding to a crisis no longer are effective, then we have to come full circle to be able to implement mechanisms and response mechanisms that are going to not only be able to deal with that crisis, but hopefully will be able to deal with upcoming crises that we might face in the future. So we needed that third principle, that durable asset principle, that thing that what we put into place for COVID-19 needs to also be able to be an asset that we can utilize and leverage for other situations and other kind of problems and issues that we faced prior to COVID-19, as well as those that are going to still be there, that are still currently there right now, but are also going to continue to, that we're going to continue to face as we move through COVID-19, even after we get vaccines and stuff like that. So those are all the kind of reasons why we want to talk about pulling that opportunity out of crisis. My belief is that if we do those things, then we can successfully and effectively deal with any crisis that we're faced with. And so this comes back to that other final question. What opportunities do you see that we can kind of pull out of the crisis that we see coming up? So for example, we've talked about this, and there's been other conversations during these last 2 days about what the kind of lasting impacts of COVID-19 are going to be, especially on the vulnerable populations that we serve. So where are the opportunities that we still need to take advantage of? What are some of the ideas or some of the coping mechanisms or ways that we can use this crisis to our advantage? And that's where we want to get some ideas, and we wanted to have that be a little bit interactive with you guys. So I'm hoping that we can get some Q&A, some comments or some thoughts in the Q&A, and we can talk about those a little bit. Or at this point, if you have other questions about the presentation, you can also do that as well.
Eddie, I received a question in the chat from Jackie. She said, I've read that those with higher vitamin D levels have lower numbers of COVID. Could that be why the homeless population's numbers are lower? I know, do you guys have any thoughts on that?
I'll punt that to my epidemiologists in the room. Which are all three, Josh, Amy, and Victoria.
Yeah, I didn't know what you meant about lower. We're not seeing lower. Are you saying that we're seeing lower rates of COVID among the homeless? Because that's not what we're seeing. So maybe
that's what the question said. She's read that those with higher vitamin D levels have lower numbers of COVID. Yeah,
there's some question, and Josh at least does a better job, it seems like, than me lately, of being able to read those articles on things such as vitamin D or other risk factors. There was some sign of that, I don't know. But no, what we were trying to point out earlier is that we have seen actually quite a bit of higher rates, at least for us here in Hawaii, among the homeless in particular, because we've had these clustering events in our shelter population, as well as kind of this system as we see overlapping, not completely the same, but some of the outbreaks that we've seen in the correctional centers and our behavioral health treatment facilities in some of the other congregate living and homeless shelters. So we have actually not seen lower rates among the homeless. I don't know, Josh, if you want to add anything.
Yeah, no, I was just going to say, I think also that we have systems in place, Project Vision, who are doing routine surveillance. So it is a population that is being tested very often, at least monthly, depending on where they're located. So we do know there's a lot of people out there with undiagnosed or, people who are infected but don't get tested. So yeah, we are definitely seeing, COVID among homeless populations here, and it's not recently more.
Yeah, and I just want to point out too, in that vein, is that while we've been very lucky to not see the rates of COVID spread among homeless and other vulnerable populations like the mainland has had, the aggregate numbers don't seem as high, but actually the positivity rates are just as high if we look at kind of just the positivity rates for those particular vulnerable populations. And I think, I attribute a lot of our success to you folks that are out there kind of boots on the ground doing this work, right? IHS, a lot of you know that we worked with IHS early on when there was an outbreak at the men's shelter to really kind of nip that in the bud and address it, right? So I think the message there is that while the number of folks has been has been aggregately lower over the last several months and over the last year, doesn't mean that we can kind of rest easy, doesn't mean that we can not continue to take the precautions that we need to in order to kind of address those positivity rates. Do you agree with that, Josh and Amy? Yeah. Okay, so in terms of opportunities, there was one other comment. There was about telehealth. Thank you for that. That's that. One of the opportunities that we are seeing, and kind of a silver lining from COVID, right, is that there's been a lot more focus. A lot of you remember, right? There's been talk about kind of implementing telehealth into our, kind of systems, our social service systems for a while now, at least for the last, 2 to 4 years, right? Lots of talk, lots of efforts, that kind of stuff, good efforts. But COVID really created that opportunity for us to fast track the implementation of telehealth and telework into and out of necessity into our day-to-day kind of operations. And so we definitely see telehealth and telework as an ongoing opportunity for us to continue to capitalize on, to be able to more effectively access, especially populations that are rural and remote and that may not have as much access. The flip side of that coin, as we've talked about in the past, is how do we get the technology and the equipment to those kind of hard to reach folks in a way that still increases the access of telehealth and allows people to utilize it. So those are some of the opportunities that we continue to look at. Other opportunities or questions? So I'll share one opportunity that we continue to see for us, even though it's in the face of some pretty severe budgetary restraints coming up in the next, at least the next legislative biennium, is that what we know and what we've seen is that through coordination and through kind of linking of resources and thinking outside of the box in terms of how we respond to and how we provide services that are needed, I think that there's an opportunity for us to really fast track some of the issues that have been facing us around things like mental health emergency, MH1s, around placement, around housing, stability. A lot of you may have heard me talk about stabilization beds and that process of really kind of implementing subacute care, Polycana, T-Quick, some of the other quarantine and isolation sites that we have. All of those are, from my perspective, proof of concept of why we need those things in order to address both homelessness and behavioral health, as well as an ability for us to say, to hold those things up as, if we do this, we actually reduce burden and cost to the broader society, and also effectively are able to support folks who need those services and those supports. So we're excited about some of the things that we have going on in terms of quarantine and isolation and stabilization beds. We're excited about some of the things that we have going on, and that through COVID, we've been able to implement more quickly up at the state hospital from a perspective of effective crisis diversion and those kinds of things. So we're excited. One last thing that I'll say is that COVID has allowed us and helped us to be able to implement things that were barriers to us being effective before as a system. So one example is that we have a system of transportation. Through COVID, we developed a system of transportation vans for quarantine and isolation, but the hope is that we can keep those so that transportation no longer is a barrier for accessing services. Same thing around beds and having short-term beds for people to go to, just to bridge that space between coming from the street to going into a more long-term situation like residential treatment or supportive housing.
And then Eddie, I just wanted to put in, I think for Josh and I, before we end, just, probably another call for vigilance. We're seeing with some of the numbers right now and some of the positive, results that we're finding for the different groups that we've talked about, that it may be on the increase again. So just really ask you all, remain vigilant. Please let us know how we can help. We're going to have to do this together. It is one system, but remain prepared.
Well, our time is short, and I just wanted to mention that we had a question from Betty Lou Larson in the chat, but it turns out it was about breakthroughs in collaboration of systems and what's resulted from those. But she said you guys answered her question just as she was sending it. So good job, guys. So yeah, I don't know if you had any more thoughts, because we're up at 11:59.
We're good. Thanks, Jason. And thank you, everybody, for attending, and appreciate everybody's work out there.
Yeah. Thank you to our panel. Thank you for the great information that you provided today. I just want to mention to everyone that I put in the chat box the link to the Office of Housing conference page. So if we can, we'd love to have you join us for the closing plenary by Ian DeJong of Orco Consulting, and also the closing remarks from Scott Morishige and Mark Alexander. But otherwise, just last thing is the session was recorded, and it will be available on the City's Office of Housing website. It should be available in the next couple of weeks, along with the other sessions from yesterday and today. With that, I just want to tell you, everybody, thanks for joining us, and aloha. Hope you have a great rest of the day.
Aloha, everyone.